So thank you everyone so much for coming to our presentation today for National Infertility Awareness Week, or month as we've sort of been extending it. I think there should certainly be more than a week acknowledged to infertility. So our talk is Fertility Olympics, Maintaining Mental Stamina During Fertility Treatments. I'm Rena Gower. I am the Director of Social Work Services at RMA of New York and a licensed clinical social worker. And joining me is my amazing colleague, Dr. Georgia Witkin, and I will allow her to introduce herself as we start with the first slide.
And Dr. Georgia is thrilled that Rena's handling the text. You're doing better than I would be doing. So hi, I'm a professor of psychiatry and OBGYN at Mount Sinai and director of psych services and wellness at RMA USF New York. So welcome. We're very happy you're here. And we're going to go through all of the myths that are associated with infertility and fertility treatment. And the first one is really important, that stress causes infertility. 70% of women believe that, according to surveys. And you'll be happy to know it does not cause infertility. If it did, there'd be no women getting pregnant during wartime. There'd be no people on the face of the earth because women are always stressed. And not only that, but if in fact you have physical stress, let's say you're running the marathon, or psychological stress, it is time limited and self-correcting, because basically nature wants reproduction. So if there's a viable egg and a viable sperm, there is conception, unless there's something physically wrong related to age, underlying conditions, behaviors that really do block it. So what I'm saying is, and Rena will back this up, don't believe Aunt Fanny. If your Aunt Fanny was like mine, she'd be saying, it's because you wanted too much. You work too hard. She'd be saying all kinds of things that lead to self-blame. And we're here to tell you, you are not creating your problem. In fact, my Aunt Fanny used to say, adopt, because once you adopt, you relax and then you get pregnant. There are no statistics indicating that people who adopt then get pregnant at a higher rate than anybody else. So even that is a myth. And it's important for you to know it, as I said, so you won't buy into any self-blame. And if you do start feeling like you are getting stressed, because even though stress doesn't create infertility, infertility creates stress. So here are some tips. Number one, don't relive what you should have done and could have done. Don't pre-live what might happen, what might not happen. Try to stay in the present. Give yourself time outs. Harvard found that 20 minutes a day, even if it's broken into 5 pieces of timeouts, to do anything you enjoy. I don't care if it's, something on TV that you love, or closing the door to the bedroom and dancing around just to get rid of some of the adrenaline. Any kind of timeout for a total of 20 minutes a day reduces stress symptoms by 50%, which can be very important when you're dealing with infertility for yourself, not for your infertility. What's interesting is if you add up the time you have and the time you need every day, most women find that they're at least 20 minutes short every hour. So this is a way of counteracting it. Last but not least, and we're going to say this a few times, talk. Everything sounds less frightening and upsetting when you say it out loud to somebody rather than thinking it in the middle of the night by yourself. Not everybody will do as someone to talk to. You want somebody who understands because they've been through something similar. So when they say, I understand, you know it's for real. So there are therapists that are trained. There are groups of people going through it simultaneously, and you can usually find those people right through your practice, or contact Rena and myself at RMA of New York. We'll give you more information of that at the end. Your turn,
All
Rena.
good points, Georgia. Thank you so much for sharing those. And that leads us to myth number 2. Infertility is more frequently a female problem than a male problem. Absolutely false. As we know, infertility is 1/3 female, 1/3 male, and 1/3 unexplained. So across the board, it is an equal opportunity offender. And I also like to reframe and not view it as it's not a problem. Infertility is a disease. The World Health Organization acknowledges infertility as a disease. So it is a disease, but it is not more common among females than males. And so often I see in our work the female taking on a lot of responsibility, a lot of blame, a lot of the labor involved with going through treatment. And so something I talk a lot about with clients, if they are in a heterosexual couple, is how to help both partners feel involved so that there's not a resentment built among the two of them where one person feels as though they're taking on the brunt of the labor. And this can really apply to anyone that's going through this as a couple. It does not have to be a heterosexual couple. Anyone that's going through a couple where one person is carrying, and therefore they're the one who's using their body to go through treatments. They're the one, having to go to the appointments physically to be there, do all the shots, do all the ultrasounds and everything. So something that I find really helpful for people is talking about how to kind of divide labor. So maybe the person that's not doing the shots, they're in charge of making phone calls, talking to insurance, organizing medication. Maybe they're the ones that set an alarm to remind the partner, oh, hey, it's time to do the medication. They organize everything. Maybe they're in charge of discarding the sharps. But any way to help the other partner feel involved, because even if it's not your body going through it, there are so many things that are required going through treatment, and it's a lot of work and time, which can add to the stress. So how to help delegate that amongst a couple can be really helpful and help take the stress off of one person. So I think that's really important to do in the process.
Okay.
Throw it back
more information. And as you're probably guessing by now, just about everything we're talking about, all these myths are false beliefs that are very, very common. This one also. You've probably heard of Elizabeth Kubler-Ross, who was a Swiss psychiatrist, stages of loss, and the concept that there are neat stages that we go through when we cope with loss turns out not to be true. There has been no research, according to a huge review in Scientific American, of any evidence of a sequential neat stage of loss. And here's the problem with believing it. Here's what Kubler-Ross said. She said, first there's denial, then there's anger about the loss, then there's bargaining with yourself or with God. I'll be better, or, I'll observe everything. Next, depression, and finally, acceptance. The problem is, number one, that if you believe there are neat stages that you're supposed to go through, you're going to worry if you think you're skipping one. You're going to worry if you think you're not feeling what you should be feeling. You're going to probably delay treatment or moving forward until you feel like you've worked through all these stages. I have a lot of people saying, I'm really not ready for the next IVF or for ovum donor because I don't think I've worked through all of the stages. The problem is that it delays recovery, and that is not how life works, and that's not how infertility or emotional recovery from infertility works. First of all, Yale research, I have it in front of me, in the American Journal of Medicine. Anger is the least experienced after loss. I mean, people have sadness, they have all kinds of other feelings, but sadness is the least. It's a grab bag of emotions, and everybody has varied stages. You can have more than one feeling at the same time. You can be scared and hopeful at the same time. You can have resilience as well as feeling tired and overwhelmed, because resilience is natural as well. I mean, what's important to understand is that basically we're built for daily life, and we do eventually come to acceptance, but it's not by going through neat stages and working through neat stages. As I said before, there can be any variation. You can have just one, you can have two, you can have three, and it might not be in that sequence. What's important is that since we're wired for daily life, it's our daily life that we should stay involved in and will help pull us through to acceptance, because that's what we're built for. That's what will bring us smiles again. That's what will bring us comfort. That will bring us kind of larger perspective, and everything that we learn on the fertility journey should be information for the next step. So some of it is how you talk to yourself. And if instead of saying that was a disaster or a failure, you say, okay, that was an opportunity to learn about a new approach. So I'm hoping you have a very easy journey if this is what you're embarking on.
I would add to that as well, just the concept of intangible loss. I think that often resonates with people as well when they don't understand. We think about a loss as something tangible, right? Whether it's like a death, but with infertility, there's so much intangible loss. So it's this loss we can't see, whether it's, the surprise of taking a pregnancy test at home, or a gender reveal, or conceiving at home. There's so many stages of loss here. And so I think acknowledging that and understanding it's not just the loss of, not having a positive beta or having a miscarriage. It's the loss of feeling autonomy in conceiving, and it kind of builds and it builds. And so I think a lot of times people, they don't recognize that that's what's happening, and that's what the feelings are. But to understand there's a lot of intangible loss. So it's this loss we can't see, which makes it difficult to grieve unless we, work through that with a therapist and understand what's going on. And then B, makes it really hard to communicate to friends and family because they don't necessarily understand that all of this grief is happening in your life. And so that sort of goes back to what Georgia was saying at the beginning, these people that might say like, just relax, or why don't you adopt, or whatever, things that make us not feel good because we're going through so much grief and loss. And so just that idea of the intangible loss as well, to just add to what Georgia said. And then myth number 4, for fertility patients, work can actually be a help. So I see work go either way. A lot of people ask me, oh, should I apply for FMLA? Should I take off work? And I always say, I think it's really important to be busy when doing this. If you think of your life as a pie chart, and life is made up of so many different things. We have social life, love, career, finance, home environment, joy, spirituality. There's a bunch of pieces of our pie. And so it's about fitting in a fertility journey into your pie. It's like opening it up and putting it in there, not letting it take over the entire pie. But also, if you imagine it sort of like gracefully fitting in. And so I think it's important to really stay busy, but also give yourself grace. So I see so many women going through this, and, they're operating at 110% already in their daily lives, doing all the things, working really hard, working out, friends, family, all the things. Then they feel like they need to keep operating at that level while adding in fertility treatment. And going through fertility treatment is the same stress level as cancer or heart disease. That's really, really high. And unfortunately, society has not caught up to us yet to understand fertility treatment equals stress. I think we understand if we heard a colleague or a friend or family member was going through cancer treatment, we'd say, oh my gosh, like, what can I do to help? Can I bring you a meal? Can I take some work off of you? What can I do? And so society may not understand that yet about fertility treatment, but I think it's up to us to, again, realize, okay, what can I do to sort of rebalance my life? I'm going to add fertility treatment in. So I may need to dial it back at work a little bit. I may need to delegate some tasks. I need to go easy on myself. Maybe I ask my boss if I can work from home more, if that's not already what you're doing. And it's meeting yourself where you're at. So, okay, I'm adding in this stressor, but when you give up all other aspects of your life to just focus on treatment, as some people often do, you then tend to ruminate on this, right? You then start to feel all sorts of symptoms and hyper focus, and just, refresh your phone all day waiting for the email to come through or the doctor to call you. And so that's not an answer either. So I think it's a balance. And it's also about understanding that this isn't you forever. So this doesn't mean that you dialing it back at work or changing your exercise or whatever is you for the rest of your life. It's you while you're going through treatment. And so to take some comfort in that this is situational, it's temporary, and how can you give yourself grace and try and swim with the current on this instead of against the tide. And that leads us to our final myth, number 5.
And that really segues perfectly from what Rena was talking about. I've written 13 books on stress, and I can condense them all into one sentence. Rena's heard me say this. When your sense of control goes down, stress goes up. And that's a definition of going through infertility treatment. You don't know what's coming next. You can't predict what's coming next. All your life, you probably studied and got A's or worked hard at work and then got promoted. And here you feel like there's nothing you can do. So as Rena was saying, that's also the silent part that you're going through. You would love to find a way, of being able to increase your sense of control. And that's another reason for not leaving work, because that's one place where you can feel like you're in control and get feedback for being effective, even though it might be hard in treatment. And speaking of work, most fertility patients don't share at work, not because of shame, although you'll read that on the internet all the time. But here's the list of why people say they don't share. Huge percentage says they don't want to hear everyone else's stories. The minute they talk about their story, everyone's saying, oh, well, that happened to my sister or that happened to me. You're going through it. You don't need anyone else's stories. Number two, they don't want to be asked questions about their situation. And once you share, that gives a lot of people psychological permission to become part of the conversation. They don't want to be monitored. Once I say something, if it takes 6 months to a year to 2 years, I don't want someone asking me for the next 2 years how it's going. Also, and I've had this happen in other areas, you tend to get recommendations. Oh, I have a doctor. You should switch your doctor. You should be going to this acupuncturist, or you should be eating this. If you're going through it and you've done your homework, you don't want all these recommendations. And last but not least, very altruistically, a lot of people say, I don't want anyone who becomes pregnant to then feel uncomfortable in front of me, even though, in fact, I might be uncomfortable when I see them pregnant. What begins to happen, unfortunately, is that going through infertility treatment, we very often withdraw, anticipating situations that are going to make us uncomfortable, like being with the family when your sister or sister-in-law might be pregnant. And the problem is that then we don't get support. We feel more isolated, and we're going through something very, very difficult. I have a few pieces of advice. One is that I'm going to share with you a poem from my grandmother, which really has helped me in every phase of life. Everything they say and do is information about them, not you. So it takes training to not take in criticism and start criticizing yourself, or taking in questions and start questioning yourself. That takes practice. Practice looking out through your eyes at the family, at the situation, at your situation. Don't worry about how you look to everybody else. Just see what you want, what you need, what you can get. And if somebody is asking you inappropriate questions, remember I said when your sense of control goes down, stress goes up, take control of the conversation. Don't be embarrassed to say, I'm on question overload right now. Or how sweet of you to care and ask. You'll be the first to know. Don't think you have to be a victim if people are putting you in a position where, in fact, you think that it might kick up a remnant of shame, even though we've been telling you all hour, this is not a shame situation. So if you're really stuck about what you should say to yourself in a situation where you're feeling awkward, and whether it's in the office or whether it's your family, just think what you'd say to somebody else who is telling you that same problem, and then say it to yourself. Because the secret of therapy is that what you say to yourself is more powerful than anything Rena and I say. What you take away from us is anything you can say to yourself. And that's what we hope to be giving you, things that you can say to yourself.
So that wraps up the sort of 5 myths that we wanted to talk about. We wanted to leave plenty of time for Q&A. And then, of course, here on this slide is the info for RMA. Please reach out any questions, but I'll open up the Q&A now. So I hope there's a lot of good questions. And I am unclear if I can open it while screen sharing, but I'm going to try. Yes, I can. Okay, so loved what you said about roles that the partner and non-pregnant partner can divide, such as making appointments, tracking medication. Is there a list or handout available? I do not have a handout available. That's a very wonderful request. So I will make a note that we can certainly work on that internally. I love that you're into that. I'm so happy that it was, that it was helpful. We can work on that. I do think that I have, not to plug my own book, I have a book, it's on Amazon, it's called Infertility 101. I believe that I've detailed it in that book, if that's helpful, but I love your question, and we can start working on that internally. So
I'll also give you a resource on Psychology Today online. I have 86 columns under Chronicles of Infertility, and many of them deal with partners.
Great.
What you can say to them, how you can work together, and so forth. So between Rena's book and all of my columns, you probably will have a good starting point.
Great. And it's sort of just thinking creatively. If you think about it, basically you think about everything you're doing. I mean, you have the list already, because it's, well, what am I doing to deal with this? Oh, okay. Make a list of everything you're doing, and then just look, okay, well, what can I delegate? Like everything that's in your column, all right, we'll start to put some in column B for your partner. So it's pretty much that you have that list, and hopefully even hearing that is empowering for you. Are there any other questions? We have a fair amount of time, and so we would love to answer anything. It doesn't have to specifically be about what we talked about in the presentation, anything around mental health and fertility, any questions at all. We would love to answer anything for you. I will leave it open. Oh, here we go. It's got another one. How to work through the fear of having a miscarriage. Had my first round of IVF, got pregnant, but resulted in a loss at 5 weeks. The high from happiness was so high, but then the low was destructively low. How to manage emotions for next trials. Do you want to start off answering that, Georgia, and then I can
Sure.
chime in?
You can Google the statistics on miscarriage. It's usually somewhat reassuring to find out that 20% of pregnancies end in miscarriage, and very often the woman doesn't even know she's miscarrying. So it kind of normalizes it and reduces the fear that it's going to happen again because it happened before. It really can be a one-off. Number two, cognitive restructuring just means instead of seeing it as a disaster that happened, see it as potential information for your doctors in terms of moving forward. And what I find among my patients is that what feeds the adrenaline, because as I said, we are wired to want to predict what's coming next and to be in control. So we spend a lot of time trying to figure out why it happened and how I can prevent it and what it is about. And then the adrenaline flows, and then it's much harder to take the next step because there is that anxiety and fear. So first of all, speak to your doctor about what information you got, what that meant. Get all the information you can that will increase your sense of control. Understand that you didn't do anything. That's not the way nature works. And as Rena was saying, self-care. I mean, this is a time to relabel, pre-pregnancy, not lost pregnancy, and take care of yourself even half as well as you would take care of anyone else going through this, and you'll be way ahead. Rena, you want to add to that?
All great. I would chime in for what Georgia said. I would say two things. One is to add to her idea of the cognitive restructuring. I always use the analogy of a puzzle for people. And as Georgia touched upon, science and medicine is all about data. So it's all about data collection. And so I always say, if you think of it, if you can zoom out, nothing is ever a waste in this process. Everything is always data leading you to where you want to go. So even though the loss is devastating, and it's really important to grieve the loss and let all the feelings flow through you, no one can take away from you that you've done all of this work. And that's a huge collection of data for your physician. And that's so important. And you've got through that, and you put in all the work and the time, you collected that data. And so that's a huge piece of your puzzle that you've just put in. So if you can think of that analogy and sort of macro level, it is leading you where you want to go. But it is sort of having these juxtaposing emotions, right? about the same event, and that's very hard. Then I would say in terms of how to sort of then move on to doing it again, you know, so much of fertility treatment is, if you ever took a Psych 101 class, it's sort of this, it's conditioning, right? As humans, if we stick our finger in an electric socket and we get electrocuted, we're probably not going to do it again. My personality, I would probably do it one more time just to like make sure, but then I wouldn't do it again because twice I'd be burned. So I would stop the behavior. Fertility, unfortunately, it's like we have to keep repeating the same thing that's burned us. And so psychologically, that's really difficult. Like, why am I repeating this behavior that hurt me so much? So something I say to people that I think is super helpful is you always want to tell yourself, right, if you're gearing up to try again and repeat this behavior, tell yourself, one, okay, like I've never done a transfer in, May of 2024. It's a new month. This is a totally new experience. Anything you can say to yourself and talk yourself through to help you feel like this is a new experience. So even take a different way to the office, like go around the block a different way, open the door with a different hand, sit in a different seat in the waiting room. Anything you can do to change the experience so you don't feel like you're repeating the same event is also going to be really helpful as you start up again, and that sort of, trauma from what's happened bubbles up to the surface. So that's another tip that hopefully is helpful.
Good one.
Okay, let's see. Next question. Any suggestions for how to deal with all the anxiety during the waiting periods? Great question. 2-week wait. You want to start, Georgia?
Sure. Let me start with the simple ones. Number one, burn up the adrenaline. I'm not saying join a gym. You don't have to get on a bike. It turns out any physical movement at all will help you burn up the adrenaline, will distract you, particularly if there's music going or if you're walking your dog. Paint a wall. It doesn't matter. Burn up that adrenaline. Number two, brain doesn't know if you're organizing your wallet or reorganizing your fertility or, fixing what's wrong in the Middle East. So anything you can get control over that gives you a sense of control, and, even if it's reorganizing, as I said, the kitchen drawer, will help momentarily. So understand that when you don't know what's coming next, the adrenaline pours out, and it's really meant for running from a bear. That's 5 minutes. It's either going to catch you or you're going to be up a tree. It's not meant for a year of infertility treatment where you're anxious. So don't let that adrenaline keep wearing you out. It's meant for short term, and you want to last the long term. And as we've both been saying also, find somebody who you can speak to, who is not going to do the talking or take over or tell you what to do or take control or talk their stories. Find somebody who's a good listener so you have a chance to hear yourself. I've heard patients say to me, and I'm sure Rena has as well, like, this is just too much. I can't do this anymore. And then they pause without my saying anything and they say, well, no, I do want a child. And this is actually something I'm choosing. Yeah, one more and one more, or one more differently, or I'll try it, with a different doctor or whatever. But hearing yourself is really important. So give yourself opportunities to talk it out so you can hear yourself.
Yeah, and to add to what Georgia said, the idea, I always help people or encourage them to plan. So you want to think beyond just the 2-week wait. So, okay, you have two options, right? So one is you get a positive beta. Great. Okay, we kind of know what happens from there. You're going to keep going to monitoring. Hopefully, everything progresses. Okay, option B. If you don't get the result that you wanted, and I don't like to say negative beta, I like to just say it's not what you wanted. Well, what are you doing next? And I want you to have that all planned out before you get the answer so that you can keep going and you don't feel stuck or like you've fallen off this cliff and you don't know what's happening. I think it's always about planning and being prepared and knowing what's happening so that in the moment, okay, well, I'm going to take today. I'll be really sad about, what's happened, but then I know that I'm still moving forward. And then sort of back to the analogy of a puzzle, this was another piece in your puzzle, huge. And just always be forward thinking, always be forward thinking. And then, of course, I love mantras and affirmations throughout the wait, like I am worthy, I am capable, I am deserving. And then sort of the idea of like, set it and forget it. You did it, you know what to do throughout the wait in terms of the medical part, when you're monitoring, but that's it. Then just live, try and do things to distract yourself, try and, do those other pieces of the pie that life is made up of, so that this is a piece of your life, not the whole.
Go back to that idea of the neat stages of recovery, which don't exist. As Rena was saying, the last stage, the one that really brings us to acceptance and hope and forward, is moving forward. And it's daily life, as Rena was saying, that brings you to that, because that's what we're built for. That's where our resilience is. That's where we see the big picture. That's where we know what we want to put in our life. If it's a child, and there's always a way. I mean, right now you might be trying infertility treatment, but there are other options as well. And keeping the big picture is really what moves you forward. That's the real last stage.
Absolutely.
Of recovery.
Yeah, totally. Big picture. And then also, if there's trauma involved, it's also, support groups or a therapist who specializes, who can validate for you what you're feeling. I love support groups in this realm, particularly ones led by professionals, because, and we'll send you some or share some resources at the end of where you can find these, because you want to be around people that can validate you and who know what you're going through, and people that get it, and finding that can be really helpful, because then it also takes some of the burden off of your friends or family or partner, because you're letting other people who really understand hold space. And then likewise, it can give you a purpose too, to hold space for somebody else and kind of get outside yourself and help someone else. So that's another really great way to just help, not just through the 2-week wait, but the process in general, that I would add. And I would add too, research shows that people going through this who don't share have higher levels than anxiety and depression than those that do share, whether that's to a therapist, to friends in a support group, et cetera. So it's sort of, what is your comfort zone, but sharing and having people hold space for you and validate feelings is really important. Okay, so next question. Similar to the question about the miscarriage, after having multiple miscarriages, how do you get yourself out of the loop of the fear of bad things happening again and again? It's hard to be positive that something good will happen when you feel like you have proof that bad things happen more than good. Great question. I feel like we've touched upon sort of some ways to kind of get out of that stuck cycle. I would say certainly, what Georgia pointed out, going to your physician and talking about data and statistics and plan is really important, so you don't feel like you're repeating the same behavior. And this is where I think patient advocacy comes in. I think a lot of times people are afraid or fearful or don't know that they can actually have that call with their doctor. It's really important that you have that talk with your physician. Okay, what's the plan? Why are we doing this? What are the stats? And then, sort of the idea, I of course don't like toxic positivity, which is sort of that idea that we should just be happy all the time. You don't have to be happy all the time. You can mourn this, and you can be sad and angry and stressed and all those feelings of grief. If you've gone through multiple miscarriages, that's extremely difficult. It's important to let yourself feel that. And again, for that, I would also recommend a couple of groups I refer to a lot for pregnancy loss is a pregnancy loss support group, Postpartum Support International. They both have ongoing support groups and free counseling, and they're really fantastic resources for that, because it's important to work through that. And, I think how do you get yourself out of the loop of the fear of bad things happening again and again? Sort of that idea, like fall down 7 times, get up 8. And instead of sort of like the why me mentality, like, what is this teaching me? What can I learn from this? And you might not be able to answer that in the now. I know back when I was going through fertility treatment years ago, I couldn't tell you. I was in this stuck cycle and loop, and in this really big, very, very dark place. For me, what was really helpful was joining Resolve, getting involved, talking to other people, and then getting into this professionally. But, I think it is about, that idea of like, what is this teaching me? What can I learn from this? Or, talking to other people, getting your feelings validated. Georgia, is there anything you want to add to all of
I
that?
did. We haven't spoken about it, but I think it's important to remind everybody that in addition to the psychological and the social and the interaction, and there's also the hormonal. This is a treatment that involves enormous hormonal changes. You'll be taking hormones typically, as well as if you're losing a pregnancy, there'll be a drop in progesterone and estrogen. And we know that that can cause mood changes. There's enough going on. So it mimics PMS, it mimics menopause, it mimics every hormonal crisis that we have in our lives. So on top of dealing with, how do I process what happened? How do I make use of it? How do I, have the courage to move on? In addition, you're dealing with enormous body changes, fluid retention, and then, drops in hormones. So again, as Rena was saying, make sure you're communicating with, your reproductive endocrinologist, and make sure if you're feeling low, beyond just processing what happened, if you really feel like you can't participate in your daily life, check with your doctor. There might be things that they can do to just help you regain your stamina, let alone, your psychological resilience.
Absolutely. Okay, the next question, are there therapy, counseling, or similar services for those going through the fertility treatments, considering going through egg retrieval process to freeze my eggs, and would like to know any support structure? Yes, if you are coming through RMA USF, we do have those services, myself and Georgia and our staff. So absolutely reach out to your coordinator and they can get in touch with you. If you're at another clinic, some clinics do have those services. Just ask your nurse or coordinator. And if they don't, there are very wonderful groups out there that can offer support. There's a lot to sort of say on this seminar. I would say if you go to the Fertility Forward podcast, which is hosted by myself and my colleague, Dara Godfrey, Georgia is a very frequent guest. We have interviewed a lot of women that have started companies to offer counseling. So if you just go through our podcast episodes, there's a lot. Day One Fertility is a great one. Conceive is a great one. And just you go through the podcast, there will be some other resources there. And then
I think if they go also to Infor at RMA New York, it's INFOR at RMANY.com. There'll be a lot of information as well as a link to your podcast and to other resources. Yeah.
Okay. Yeah, that's great. Yeah. Do you have suggestions for handling being surrounded by pregnant friends when you're going through the emotional ups and downs of fertility treatments? Do you want to start, Georgia?
Sure. I think around the holidays, that's the number one question I get. And I have so many columns about that because that's the question. That's what my patients are asking me. And I basically say, give yourself a break. You don't have to make yourself go anywhere. If you really feel that you need a break from answering questions or being in awkward situations or seeing people who've become successfully pregnant, then give yourself a break for that. Every time you increase your sense of control, you'll be able to breathe more easily, because what's true about the fertility journey is there's very little sense of control or ability to predict what's coming next. So I am here, and so is Rena, to give you permission to not be a victim of questions or holidays or family gatherings. If you feel that it's going to be difficult for you, you can take a time out. What do you think about that, Rena?
Absolutely. Yeah, I couldn't agree more. I think it's about figuring out what works for you. And it's, again, that idea of this is situational. It's not forever, but maybe it's, if you feel, you're being invited to a lot of baby showers and that's really uncomfortable. Maybe you just send a gift. Maybe you go at the beginning, or maybe you go at the very end. So you're not there for the whole time. I think what's really important is just the idea of communication and not ghosting friends. And so to figure out for you what's comfortable in terms of sharing. If you are comfortable sharing what you're going through and saying like, look, this feels really triggering for me. I'm so happy for you, but I'm just not comfortable coming to your baby shower. Then you send a gift. Great. Your friend will totally understand. If you're not comfortable sharing, you kind of make up a little white lie why you can't be there. So I think it's definitely not ghosting, because I think that can maybe add to your stress, but it's figuring out what works for you and then communicating, in a way that's comfortable for you about how you can be there for a friend. And it might look different than who you were before, and that's okay. And then I think too, also, just give yourself grace, and I love, the idea of practicing gratitude. So if that's feeling really bad, combat that by thinking about what's good in your life. What do you have? Instead of focusing on what you don't have, 3 things a day that you do have, 3 things a day that you're grateful for. There's so much research to suggest that practice, it sounds so basic and simple, but it really does rewire the brain. It rewires the synapses in your brain so that you can view things through a more positive lens. So I would definitely add that to a daily practice, just to help with focusing on what you do have instead of what you don't.
Back to my grandmother's poem. If there are people in your life who don't understand how you're managing this or what you're going through, remember her poem is, everything they say and do is information about them, not you.
Absolutely. And Georgia, you obviously know, right? The idea that, a lot of times people, they displace or project, how they respond to you. It's not about you at all. It's their own feelings of self, but they just either don't have the awareness or they can't sit with them. And so it's put on to someone else. So, Dara Godfrey, my colleague, and I, we often talk about the book, The 4 Agreements by Don Miguel Ruiz on our podcast. And one of the 4 agreements is don't take things personally. And so I think that's a really important tenet to live by, is not take things personally. It's not about you, but how you respond and whether you're reactive or how you handle it, that is, and you can control that.
And even if it is about you, it's still information about them.
Yes, exactly.
As you said, projecting onto you. So words to live by.
Absolutely. Okay, next question. Any tips for handling timeline anxiety? Not even just 2-week wait, but timing of cycles, scans, retrievals, transfers, while trying to still live a semi-normal life. I would say, no, go ahead.
I have a support group for people going through infertility who themselves are in the infertility field. So it's like a double whammy. And the other day, they were all, on the Zoom saying, I tried not to test, but I did. I didn't even wait more than 24 hours. I had to test. I had to take the hormone test. I had to take the blood test. I had to see where I was. And they kept saying, yeah, I'm neurotic. And I said, stop. That's not neurotic. You've got to, as Rena's been saying, you've got to give yourself a break. You've got to just learn. No matter what you say and do is information for you about you. And if you're the kind of person who wants to predict what's coming next and needs to know what's going on, then you've learned more as you're going through this journey about who you are. So there's no right or wrong way to do this journey. There's just going to be your way. Mm-hmm. And that's true of the timelines too.
Yeah. And I think, that question, it's about, you could sort of sub in sort of any life event, it's basically just about how to handle anxiety. And the fertility, it's sort of the catalyst, right? That's causing the anxiety. But you could sub in anything, right? Like humans, anxiety is normal. So I think, there's a bunch of, again, not to plug my book, it's just the most sort of like, it's all in there, sort of a bunch of exercises of how to handle anxiety. I love a bunch of different grounding exercises if you're feeling super like high adrenaline, cortisol. So one of them is the 5 senses. So in no particular order, 5 things you can hear, 4 things you can see, 3 things you can touch, 2 things you can taste, 1 thing you can smell. That can really ground you. You could take an object, like a small object in your hand, just focus on everything about the object, the weight, the texture, touch, sit in that. Bonus points if the object also is either like very cold or hot, not going to burn you, but just like another temperature. Come up with 50 baseball teams or 40 ice cream flavors, exercises like that, what they do if you're feeling like, oh my gosh, I can't breathe, I'm feeling really heightened, it will help refocus your brain and sort of get you out of that really heightened state. Another one I love is the thought bubbles. If you think of all your anxious thoughts, like if they're like popping up in these thought bubbles above your head, think about the thought and then pop it. Imagine it being one of those like little chat bubbles, popping it. Or imagine your thought landing on a leaf and then floating downstream, like letting it go. So any of those little exercises I think are helpful in the moment if you're feeling really heightened anxiety. And then again, sort of the macro level is about the planning, right? And the long-term plan, zooming out, and sort of looking at that. So it's a combo, I think, of both things.
Yeah, the really valuable lesson is that if you bring yourself into the present, instead of reliving what I should have done, could have done, or pre-living what might happen, in the present where you do have control and you can enjoy touching, feeling, smelling, etc., and get a perspective, you are way ahead more than anything else, as Rena said. This will stop anticipatory anxiety.
Yeah. Oh, I love that pre-living, that concept. Yeah. And just sit, like put your bare feet on the floor, focus on the ground, just ground yourself. Like, what do you have? I have my feet on the floor, the ground under my feet. I have today. And, you know, sort of the idea like suffering is impermanent, or this too shall pass, and just be here, just be with today, focus on what you do have, ground yourself in the moment, in the present, as hard as that is. So I think I'll leave it open for, you know, a minute or two if anyone else has a last question to drop in the chat. We have a couple more minutes. I'm happy to answer anything else, but I so thank everyone for attending and thank you for your questions. I thought those were really great, thought-provoking questions, and hopefully we answered them in a way that was very helpful to you. And again, the information, how to reach us, if you want to find Georgia or myself, there's the number for RMA on the screen or the email address. Just reach out any of those avenues and they will find us and guide you to us. If anything else comes up, but we're so appreciative of you being here and taking your time on a Monday night to be with us. Any closing remarks, Georgia? I don't see any other questions coming in. I'm going to leave it open for like another.
You did a fabulous job with the tech. Thank you. Thank you all for joining. And as usual, I love working with you, Rena.
Oh, likewise. You are such a gift. Such a gift. So I guess with that, no other questions and people sort of seem to be exiting. I will say goodbye. Thank you so much for coming. We really appreciate you taking your time to spend with us. We hope this was informative and please don't hesitate to reach out at all. And we really hope this was helpful. We're really just here to help and understand this is really difficult. And thank you all so much.